Hello, I'm Professor Peraza, and today's lecture video covers pregnancy, infancy through the adolescent years, and senior health. These are the specific learning objectives for this module. This module also meets the following course learning objective. A full-term pregnancy lasts 40 weeks, which should be counted from the first day of a woman's last menstrual period. Infants born before 37 weeks of pregnancy are considered preterm, and because they have not completed fetal development, are at an increased risk for a range of health problems. Pregnancy begins when the sperm fertilizes the egg, and the single cell formed from this union begins to divide and differentiate. During the first few weeks of development, the cells of the uterine lining provide nutrients to the developing embryo. Between the 4th and 12th weeks, the developing placenta gradually takes over the role of feeding the embryo, which is called a fetus, beginning in the 9th week of pregnancy. The placenta forms from tissue deriving from both the fetus and the mother, and this new organ becomes the interface between the two. The placenta provides nutrition and respiration, handles waste from the fetus, and produces hormones important to maintaining the pregnancy. The blood of the fetus and the mother do not mix in the placenta, but they come close enough that the nutrients, including glucose, amino acids, fatty acids, vitamins, and minerals, and oxygen can pass from the mother's blood to the fetus, and carbon dioxide and waste products can be passed from the fetus to the mother. Pregnancy is divided into trimesters, which are 13 to 14 week periods that are somewhat arbitrary for analysis. The first trimester has the most critical periods, which is a finite window of opportunity for cells to develop into a particular tissue or organ. There are many things that can interfere with the critical period of development. Nutrient deficiencies or toxicities, trauma, tobacco, and radiation. Effects can range from miscarriage to physical and mental abnormalities. During the 2nd and 3rd trimesters, the fetus continues to grow and develop, with final development of organs such as the brain, lungs, and liver continuing into the last weeks of pregnancy. Therefore, adequate nutrition is vital for women who are trying to conceive or may become pregnant. Weight gain during pregnancy is important and very normal. Gaining too little weight in pregnancy can compromise fetal growth, leading to the baby being born too small, which can cause increased risk of illness, difficulty feeding, and developmental delays. Gaining too much weight in pregnancy can cause the baby to be too big at birth, leading to birth complications and increasing the risk of needing a cesarean birth. It can also make it more difficult to lose weight after pregnancy. The CDC recommends the following amount of weight gain for individuals. This is based on pre-pregnancy BMI. For those with a BMI less than 18.5, the amount of weight gain throughout pregnancy is 28 to 40 pounds. For those with a BMI between 18.5 and 24.9, the amount is 25 to 35 pounds. For those with a BMI between 25 and 29.9, the amount of weight gain is 15 to 25 pounds. Lastly, if the BMI was greater than or equal to 30, then the amount of weight gain is 11 to 20 pounds throughout pregnancy. As for where that weight gain is going, the fetus accounts for about 6 to 8 pounds, and the remainder from the development and expansion of tissues and fluids to support the pregnancy, including the placenta, uterus, breast, amniotic fluid, blood, and maternal blood fluids. Additional body fat gain during pregnancy also aids in preparing the body for lactation. Exercising during pregnancy can help to promote the health of both the mother and the baby. According to the American College of Obstetricians and Gynecologists, regular exercise can reduce back pain, ease constipation, promote healthy weight gain, improve overall fitness, and help with weight loss after the baby is born. Exercise may also help to reduce the risk of gestational diabetes and preeclampsia. It is recommended that pregnant women get at least 150 minutes of moderate intensity aerobic activity each week. There are many safe forms of exercise for pregnant women. However, it would be important to consult with the OBGYN for individualized advice. Nutrient needs increase during pregnancy, which means a greater intake of calories, macronutrients, and micronutrients. Here is a visual of what a pregnancy plate can look like from Oregon Health and Science University, and you will notice it is very similar to the MyPlate visual. There is emphasis on whole forms of carbohydrates, like whole grains, legumes, and starchy vegetables. Half the plate is fruits and vegetables, with more of an emphasis on non-starchy vegetables. Protein is also present, with an emphasis on lean options, like poultry, beans, and tofu. Around the plate are recommendations for healthy fats, dairy, and exercise. Let's review calorie recommendations during pregnancy. Generally, during the first trimester, extra calories are not necessary. In the second trimester, women will need an additional 340 calories, and in the third, an additional 450 calories per day. It is important to note that these are just recommendations, and an individual's calorie needs will vary based on activity level, body weight during pregnancy, and the rate at which weight needs to be gained. Also, calorie needs may be higher for women carrying multiple fetuses. The AMDRs for carbohydrates, fats, and proteins are the same for pregnant women as they are for healthy adults. The AMDRs would be 45 to 65% of calories coming from carbs, 20 to 35% from fats, and 10 to 35% from protein. The RDA we discussed previously of 130 grams increases to 175 grams for pregnant women. The increase in carbohydrates is due to an increased need for fetal development and ensures adequate glucose for both the mother's and the fetus's brain. The AI for fiber is also still set at 14 grams per 1,000 calories. The RDA for protein is 71 grams, with an increase from the RDA of 46 grams for non-pregnant women. The additional protein aids in development of muscle, tissue, enzymes, antibodies, and hormones. Protein also supports the increase in blood volume and production of amniotic fluid. There is no specific RDA for fat during pregnancy. However, omega-6 and omega-3 needs do increase during pregnancy, with the AI for omega-6 being 13 grams from 12 grams and the AI for omega-3 being 1.4 grams from 1.1 grams. These essential fatty acids aid in fat-soluble vitamin absorption. Omega-3s, but in particular EPA and DHA, are needed for the brain and eye development of the fetus. Vitamins and minerals are also quite important during pregnancy, with folate, iron, and iodine of special concern. Folate is higher during pregnancy and lactation and needed to prevent neural tube defects. Neural tube is a tissue that develops into the brain and spinal cord. The United States Preventive Services Task Force recommends that all women who are planning or capable of pregnancy take a daily supplement containing 400 to 800 micrograms of folic acid. This is in addition to the folate found in foods, which include dark green vegetables and beans, peas, and lentils. Iron is another important micronutrient needed during pregnancy to support fetal development. Heme iron is found in animal products like poultry and non-heme in plants like beans. It is recommended that women take a supplement with iron when recommended by their OBGYN. Most prenatal supplements are designed to meet the higher iron needs of pregnancy. Iodine is another important micronutrient needed during pregnancy. Adequate iodine intake during pregnancy is important for neurocognitive development of the fetus. Iodine deficiency is not typically a concern for developed countries. However, it can be of concern for those who do not consume dairy, eggs, seafood, or iodized table salt. There are many substances and foods to avoid during pregnancy. Alcohol, which we covered previously, is not recommended during pregnancy. Alcohol enters the fetus's bloodstream via the umbilical cord and can slow fetal growth, damage the brain, or even result in miscarriage. There is no known safe amount of alcohol in pregnancy. Nicotine restricts blood flow and delivery of oxygen and nutrients that reaches the fetus and also increases the risk of miscarriage. Drugs have the potential to cause detrimental effects on a woman's nutrition status and pregnancy outcome, so it's best to discuss with the OBGYN prior to using any drugs. The U.S. Food and Drug Administration and the U.S. Environmental Protection Agency recommends choosing seafood low in methylmercury, as methylmercury can be harmful to the brain and nervous system if a person is exposed to too much of it over time, and this can have a direct negative effect on the developing fetus. Shark, swordfish, and king mackerel should be avoided during pregnancy. There is a greater risk of foodborne illness during pregnancy, so it's best to avoid foods likely to be contaminated with foodborne pathogens. Raw fish, unpasteurized products, raw sprouts, and cold cuts should be avoided. Caffeine should also be limited during pregnancy to less than 300 milligrams per day, which is about 2 to 3 cups of coffee. Consumption of greater amounts is linked to miscarriages and preterm birth. There are a few maternal health concerns that can arise during pregnancy. The first is anemia, which is when an individual has less than the normal number of healthy red blood cells. There could be many reasons for anemia, including inadequate iron, folate, or B12 consumption, and overall increased needs due to fetal accumulation of iron storages. Morning sickness, which can really happen at any time of the day, is also common in pregnancy, especially during the first trimester. This can be due to the increase in HCG, which is a hormone released by the placenta. There is also a severe condition called hyperemesis gravidarum, which occurs when there is a severe persistent nausea and vomiting, leading to weight loss and dehydration. Management for general morning sickness can include breathing cool, fresh air, avoiding offensive odors, large fluid intakes, and an empty stomach. Hypertension is a concern before and during pregnancy, as it puts the woman and the baby at an increased risk for complications like preeclampsia, placental abruption, which is when the placenta separates from the wall of the uterus, and gestational diabetes. There's also a higher risk of preterm delivery, having an infant small for his or her gestational age, and infant death. Symptoms of preeclampsia include high blood pressure, protein in the urine, and swelling in the face and hands. Heartburn can also occur during pregnancy due to the expanding uterus or hormones that slow the speed of digestion and relax the sphincters. Treatment is similar to the management of heartburn for those who are not pregnant and includes small meals, avoiding lying down after eating, and avoiding trigger foods like spicy fatty foods. Constipation can also occur during pregnancy due to hormones that relax the intestinal muscles and slow digestion, leading to more water being absorbed. Management includes fiber, fluids, and exercise. Lastly, gestational diabetes, which is a type of diabetes that can occur in pregnancy for those who don't already have diabetes. Gestational diabetes occurs when your body can't make enough insulin during your pregnancy. Hormonal changes can lead to the body utilizing insulin less effectively, leading to insulin resistance. Individuals who enter pregnancy with insulin resistance prior to pregnancy have an increased risk for gestational diabetes. Management includes checking blood sugar levels often, eating a balanced diet recommended by a dietitian, being physically active, and taking medications as prescribed. Some women will need metformin or insulin. Let's talk about lactation. Breastfeeding is a normal physiological process occurring in the postpartum period. The World Health Organization and American Academy of Pediatrics recommend infants be exclusively breastfed for about the first 6 months of life. The WHO does also recommend continuing breastfeeding for up to 2 years and beyond, along with solid food introduction at 6 months. Hormones that are secreted cause milk-producing glands to mature and ducts to branch. Prolactin is a hormone that stimulates milk production, and oxytocin is a hormone that causes the milk to be let down from the lobules in the breast. The hypothalamus stimulates the posterior pituitary to release oxytocin and the anterior pituitary to release prolactin. This letdown reflex, the brain-breast connection, is necessary for breastfeeding. Breastfeeding increases energy requirements by about 450 to 500 calories per day, part of which can be supplied by using adipose stored in pregnancy, and part of which should be supplied from greater caloric intake. The increase in calories from the diet are generally 330 per day for the first 6 months and 400 for the second 6 months. There are micronutrients of concern during lactation, and this includes iodine, choline, and B12 if the mother is vegan. As with pregnancy, there are substances to avoid during lactation. This includes high mercury fish, alcohol, and high levels of caffeine. Let's talk a bit more about breast milk. The first milk, called colostrum, is produced immediately after birth and continues for the first 2 to 5 days after the arrival of the baby. Colostrum is yellowish in color, thicker than mature breast milk, and produced in small quantities. It is also low in fat and easily digestible, yet rich in protein, fat-soluble vitamins, and minerals. Colostrum is also a concentrated source of immunoglobulins that pass from the mother to the baby and provide immune protection to the newborn. Frequent on-demand feeding, so whenever the baby is hungry, not on a schedule, helps to promote full milk production. After a couple days, colostrum is replaced by transitional milk, which is produced in much greater volume and lasts 7 to 14 days postpartum. Transitional milk is rich in fat and lactose and more calorie dense. Lastly is mature milk, which is about 87% water, 4% fat, 1% protein, and 7% lactose. Breast milk contains all essential micronutrients with the exception of vitamin D and vitamin K. For exclusively breastfed babies, it is recommended for babies to be given a supplement as recommended by the American Academy of Pediatrics. Vitamin K is also a concern as infants do not yet have vitamin K producing bacteria in their gut, so typically they are given a vitamin K injection at birth to reduce the risk of bleeding. Iron is one nutrient that is low in breast milk. However, lactoferrin is a milk protein in breast milk that increases the rate of iron absorption by the infant. Also, babies are born with about 4 to 6 months of iron storage, which is typically when solid foods would be introduced. Lastly, EPA and DHA are omega-3 fatty acids that are needed to support the brain and eye development for the babies. According to the World Health Organization, breast milk is the ideal food for infants. It is safe, clean, and contains antibodies, which help protect against many common childhood illnesses. Breastfeeding is beneficial to babies in many ways. It reduces the baby's risk of gastrointestinal, respiratory, and ear infections, and it may also protect babies from sudden infant death syndrome, SIDS, eczema, and asthma. Breastfeeding is also beneficial for the mother as it is associated with a reduced risk of hypertension, type 2 diabetes, and breast and ovarian cancer. Breastfeeding challenges can include sore nipples, especially in the beginning of breastfeeding, engorgement, which is when the breasts feel very full and may become painful, and exhaustion. Breastfeeding challenges can be addressed with the help of an experienced professional, such as a lactation consultant, but this support is not easy for all women to access. Now, there are many reasons why a mother may not be able to breastfeed and may choose to formula feed. A mother may not be able to produce a full milk supply, may not have the family support needed, or may have an illness that contraindicates breastfeeding, like TB or HIV. An iron-fortified infant formula is a safe alternative that is designed to meet the needs of infants. Formula is often made from ingredients like cow's milk, soy milk, vegetable oils, and corn syrup. While formula is a safe alternative, it can be much more costly even if a mother obtains a breast pump to express milk and bottle feed. Also, formula does not match the immunological protection that breast milk provides. All infant formulas are required by law to be safe and meet the nutrient requirements of infants, and in most cases, basic store brand formulas cost less and are just as good as other products on the shelf. Besides infant formula, no other substitutes are recommended, and this includes cow's milk, goat's milk, plant-based beverages such as soy milk, and homemade infant formula. These do not provide the right balance of nutrients to meet the infant's requirements and can cause serious problems such as damage to the intestines or the kidneys. Let's talk about solid food introduction, which typically occurs at the 4 to 6 month mark. While some babies may be ready for solid foods at 4 months, babies are not ready prior to this 4-month mark. Typically between age 4 and 6 months, infants develop the gross motor, oral, and fine motor skills necessary to begin eating complementary foods. As an infant's oral skills develop, the thickness and texture of foods can gradually be varied. Complementary foods are necessary to ensure adequate nutrition and exposures to flavors, textures, and different types of foods. The American Academy of Pediatrics says that for most children, you do not need to give foods in a certain order. Previously, it was thought that potentially allergenic foods should be delayed. However, the latest research and the 2020 DGAs recommend introducing potentially allergenic foods along with other complementary foods. Some of the signs that an infant is ready for solid foods include the ability to control the head and neck, able to sit up alone or with some support, able to bring objects to the mouth, attempts to grasp small objects, and swallowing food versus pushing it onto the chin. When introducing new foods, do it single ingredient food at a time to see if the child has any issues with food allergies. Wait 3 to 5 days between each new food. Choking is a preventable risk with infants and young children. There are foods that should be avoided for infants and young children to reduce the risk of choking. This includes hot dogs, candy, nuts and seeds, raw carrots, grapes, popcorn, and chunks of peanut butter. Infants and young children should be fed in a high chair or other supervised place. It is also not recommended to put infant cereal or solids in a bottle, as this increases the risk of choking and does not lead to infants sleeping longer. Let's review nutrients and recommendations for feeding infants and toddlers. As a reminder, the only thing that infants should be consuming before the 4 to 6 month mark is breast milk or formula. From 6 months to 12 months, iron is an important component of an infant's diet for neurological development and immune function. Iron-rich foods include iron-fortified infant cereal, which is typically one of the first foods introduced, meats, seafood, and tofu. Zinc is another important nutrient for infants, which will aid in growth and immune function. It can be found in zinc-fortified infant cereal, meats, and beans. Overall, it is important to encourage foods from all food groups for infants and young children to foster acceptance of healthy foods. It can take repeated exposures for an infant to try and accept a new food. Protein-rich foods provide iron, zinc, choline, protein, and unsaturated fatty acids. Fruits and vegetables provide potassium, vitamin A, and vitamin C. With dairy, cow's milk as a beverage should not be introduced until 12 months or later. Yogurt and cheese, cow-based or soy-based, can be provided before 12 months. Cow's milk does not contain the appropriate nutrients that formula or breast milk do, and the high amount of protein and calcium can be hard for the infant's immature kidneys and digestive system to handle. At 12 months, whole milk or unsweetened soy milk can be offered to provide calcium, potassium, vitamin D, and protein. Flavored milks are not recommended. For grains, iron-fortified cereal, which could be oat, barley, multigrain, or rice, are a way to meet nutritional needs. Offering whole grains with fiber and potassium is beneficial during the second year of life. According to the American Academy of Pediatrics, children between the ages of 1 and 3 years old need about 40 calories for every inch of height. An example of a toddler meal could be 1 ounce tofu, 1 to 2 tablespoons vegetables, 1 to 2 tablespoons of fruit, and a quarter slice bread. There are foods and beverages to limit in the diets of infants and children. Added sugars would be one area. Infants and children have high nutrient requirements, however, their volume of intake is relatively small. Foods introduced should be nutrient dense, and added sugars can displace these healthy options. Along with this, any sugar-sweetened beverages should be avoided for those under the age of 2, and this includes sports drinks and soda. High sodium foods should also be limited, as the taste for salty foods may be established early in life. Some foods to watch out for would be processed meats, salty snacks, and commercial toddler foods. Juice is not recommended before the age of 12 months. Although juice can be introduced in the second year of life, it is not necessary, and whole fruits and vegetables should be provided first. If any juice is provided, it should be 100% fruit or vegetable juice and limited to 4 ounces. You might be wondering why water is on this slide. Water is certainly important. However, for healthy infants, human milk and infant formula meet their fluid needs. Supplemental water is typically not necessary in the first 6 months. After the age of 1, plain fluoridated water can be slowly increased. Over the age of 1, toddlers will start to consume less breast milk and more solid foods. Over the age of 1, infant formula is not recommended. The average calorie range for toddlers, age 12 to 23 months, is 700 to 1,000 calories a day. Snacks can be very beneficial for toddlers as they have small stomachs. Many young children need both a morning and an afternoon snack. Healthy snacks can include apple sliced thin, avocado slices, diced cheese, and peanut butter smooth spread thinly on crackers. Let's review a term, responsive feeding. This is a feeding style that emphasizes recognizing and responding to the hunger or fullness cues of an infant or young child. The idea is to help young children self-regulate their intake so they start to build healthy eating habits. Physical growth is at its peak during infancy. Tracking growth is a good indicator of a child's nutritional status. Growth is tracked over time with growth charts, which are used to match a child's biological sex and growth. When looking at a growth chart, you will see percentile curves. It does take a few years for an infant to establish their own percentile curve, which should be maintained over time. Small spurts or lags are normal, but jumping up 2 or more percentiles can indicate a calorie excess or deficiency, micronutrient deficiencies, illness, psychological problem, or feeding issues. If an infant or child is not growing at their expected rate for several months and are consistently under the 5th percentile, this could mean that they are experiencing failure to thrive. Weight and BMI for age growth charts are good indicators of recent nutritional status, while stature or height for age are good indicators of long-term nutritional status. It is important to note that even if a child is at the 95th percentile curve, this doesn't indicate overweight or obesity unless indicated by a physical exam that they are at an elevated body fat percentage. Childhood obesity is a very sensitive topic. If a child is considered to be overweight or obese after a physical exam, it is key to focus on the behaviors. This means aiming for healthy eating habits, nutrient-dense foods, increasing physical activity, and reducing sedentary time. It is not recommended that children are put on calorie-restricted diets, as they can stunt a child's growth, cause nutritional deficiencies, and lead to a poor self-image. Let's talk about picky eating. This is very common between the ages of 2 and 4 years old. Some strategies to help with picky eating include eating family meals together, which can help with modeling habits, aim for regular meals and snacks, letting your child choose what to eat from what is being offered, and continuing repeated exposures with food. Another helpful strategy is to get kids involved in the preparation and cooking process. The more engaged they are, the more likely they will be wanting to try the foods eventually. The teenage years are a time when there is a surge, often in appetite, right before a growth spurt with puberty. On average, boys require about 2,800 calories per day, and girls about 2,200 calories per day. The macronutrients are important during the teen years, however, more teens are getting more than enough protein. Micronutrient-wise, concerns are with calcium, iron, zinc, and vitamin D. Let's talk about the health of seniors. A number of physiological and emotional changes take place during this life stage, and as they age, older adults can face a variety of health challenges. Due to reductions in lean body mass and metabolic rate, older adults often have lower calorie needs than younger adults. The AMDRs discussed previously also apply to seniors. The same micronutrients we discussed for the general adult would also apply to older adults. There are some nutrients of concern for seniors and an increased risk of deficiency. This includes B12, vitamin D, calcium, and potassium. Dietary fiber is also a concern, along with water. To slow bone loss, the recommendations for calcium increase from 1,000 milligrams per day to 1,200 milligrams per day for both men and women. To help protect bones, vitamin D recommendations increase from 600 IUs to 800 IU per day for men and women. Due to a decrease in the production of stomach acid, which can lead to an overgrowth of bacteria in the small intestine and decreased absorption of B12, older adults need an additional 2.4 micrograms per day of B12 compared to younger adults. Some medications can also decrease B12 absorption. Fiber is also important in preventing constipation and diverticulitis, which is more common as people age, and it also may reduce the risk of colon cancer. Hydration is of concern for older adults, as the sensation of thirst decreases with age. There are a few health concerns that older adults face, and many of these are linked to nutrition. The first is with sensory issues. Taste buds begin to decrease in number and size, and the sense of smell decreases, which can lead to food being less appealing and reduce appetite. Dysphagia is a concern with some older adults, as this impairs the ability to swallow. Dysphagia can be caused by a stroke or advanced dementia. Foods will typically need to be in a modified consistency, either pureed, ground, or chopped, to reduce the risk of aspiration. Another concern is the anorexia of aging, which is characterized by poor food intake, which results in dangerous weight loss. This can increase the risk for immune deficiency, frequent falls, muscle loss, and cognitive deficits. Vision problems can make food planning, preparation, and self-feeding difficult. Age-related macular degeneration is the leading cause of blindness in Americans over the age of 60. Consuming colorful fruits and vegetables increases the intake of lutein and zeaxanthin, two antioxidants that provide protection for the eyes and can help to prevent macular degeneration. Individuals ages 65 and up are at a higher risk of malnutrition. Malnutrition is defined by the World Health Organization as malnutrition in all its forms, includes undernutrition, wasting, stunting, underweight, inadequate vitamins or minerals, overweight, obesity, and resulting diet-related non-communicable diseases. Malnutrition extends to beyond just weight and also includes nutrient deficiencies, excesses, or imbalances. Malnutrition can increase the risk of poor clinical outcomes and mortality. The MNA is a validated nutrition screening and assessment tool that can help identify geriatric patients age 65 and above who are malnourished or at risk of malnutrition. The MNA consists of 6 questions that aid in identifying older adults who are malnourished or at risk of malnutrition. The questions relate to whether or not food intake has declined over the past 3 months due to loss of appetite, digestive problems, chewing or swallowing difficulties, weight loss in the past 3 months, mobility, psychological stress or acute distress in the last 3 months, neuropsychological problems, and BMI. The max point value is 14, and a range of 12 to 14 indicates normal nutritional status. A range of 8 to 11 points indicates a risk of malnutrition, and 0 to 7 points indicates malnourishment. Let's review some different programs for seniors. The first is the Congruent Nutrition Services. Congruent meals are typically provided in senior centers, schools, churches, or other community settings, and this is a great opportunity for seniors to consume a healthy meal and socialize. While SNAP isn't only for older adults, those with limited income may qualify. SNAP is a federal program that provides temporary benefits to help individuals purchase foods and beverages. Home-delivered nutrition services. Home-delivered meals can be offered under the Older Americans Act for individuals 60 and older who are experiencing difficulty leaving the home due to frailty, health concerns, or certain medical conditions. Meals on Wheels in particular is a program that provides nutritious meals, visits, and safety checks to older adults. You can learn more about this program at www.mealsonwheelsamerica.org. The Child and Adult Care Food Program is a federal program that provides meals and snacks for older adults at non-residential care centers. Senior Farmers Market nutrition programs provide many low-income seniors with access to fruits and vegetables grown in their local communities. In supporting the health of seniors, here are some strategies. The first is to aim for a healthy dietary pattern that accounts for factors such as cost, preferences, traditions, and access. Increasing food enjoyment with shared meals can help to promote dietary intake. Since older adults often see a decline in immune health, practicing safe food handling procedures would be helpful in reducing the risk of foodborne illness. Experimenting with food preparation can help with identifying textures that are acceptable, appealing, and enjoyable for adults who have difficulties chewing or swallowing.